Greetings everyone from Neo Care Clinic and Fertility Center and ATTV. We welcome you to our program of health and lifestyle. We've been discussing a series of issues affecting fertility and conception for couples, and today we are having another interesting topic that is concerning conception, and this is reproductive aging. We know women undergo what we call aging or reproductive aging, and in this case we are talking about ovarian aging. In women we have eggs, and these eggs are located in structures called ovaries. Now with age, these ovaries undergo aging, and as they age, the number of eggs in these ovaries also reduce. They reduce both in number and also in quality. This is a little different from men, as we shall see later on. Men don't undergo a lot of reproductive aging, but we shall see that their numbers also and quality of sperms reduce after a certain age. So our focus today is on maternal aging and how it affects their fertility potential, their conception success, or their pregnancy success. Okay, so we are going to realize that maternal age or women's age is number one predictor of their chances of conceiving or chances of getting a pregnancy and sustaining it. Even when we are doing assisted reproductive techniques, we find that maternal age or women's age is one of the important factors that is going to determine success of these procedures. So let me take you back to the natural ovaries, ovarian aging. There is what we call ovarian reserve. This means how many eggs are left in the pool of the ovaries. You know, with goes on reducing as they age. So at birth, women usually have about 2 million eggs in total on average, and these ones go on reducing by a natural process that we call apoptosis, that is programmed cell death. So by the time a woman sees her first periods at puberty, these 2 million eggs have already reduced to about 500,000 eggs, simply by a natural process of cell death. Now, from puberty up to the age of 35, that's when women have their highest potential to conceive and have a live baby. And after 35, that's where we see the effect of age coming in. The age of 35 is very remarkable in women. It's at this age that their fertility potentials start going down. The number of eggs begin going down. The quality of eggs also start going down. By the age of 35, we find only around 100,000 eggs left in their body, and most of these eggs are not good quality after that age. Now at the age of 40, that's when most women cross into their old age that we call menopause. Okay, and what does menopause mean? It means eggs are completely finished in the body. About 1,000 eggs are left at the age of 40, and most of these eggs are poor quality and they don't get fertilized and form babies that well and that easily. Okay, so now as we look at this factor of female aging or ovarian aging or reproductive aging, what are the other problems that are associated with this? We find that the time it takes for a woman to conceive also becomes prolonged as they age up. And we have said this is because the number and the quality of eggs go down. Okay? We know the fertility potential of a woman every month stands at around 20%. This is what we call fecundability. Okay, the chance of having a conception and a pregnancy per month, which is usually 20%. Now research has been done, and it has been realized that at the age of 20 to 35, most women have got a potential of 20%. Now, after the age of 35, this goes down. It goes down to 11%, 5%, and by the age of 40, most women have just 4% chance per month. And this is simply an effect of aging. Now, what happens to the eggs themselves with age? We know eggs undergo a process of cell division, and this is how they multiply the numbers, and this is called meiosis and mitosis. Now, this process of cell division is well regulated in a young woman, and when cells divide and they unite again, we find that the genes or the chromosomes which are in the eggs themselves have to be rearranged and reorganized in a very programmed manner. Now, as women age, this programmed rearrangement during cell division does not occur, and therefore we have eggs with a lot of errors in their genes. So we start seeing now poor quality eggs with genetic defects, and these are the defects that lead to abnormal pregnancies. So as we shall see, as women age, their risk of getting miscarriages, recurrent pregnancy losses is higher, simply because of accumulated damages to their eggs at the level of their genes or DNA. There are some tests we do on women to measure their ovarian reserve or their fertility levels, or what we call fertility potential. We usually do these tests on women who are older than 35 years and they are trying to conceive. Okay? We do two major tests. One of them is called Antumarian Hormone. This is a hormone produced by those cells that surround eggs. They are called granulosa cells. So when cells reduce in number, this hormone also goes down. When the eggs are still good numbers, then this hormone is high. So that is called Antumarian Hormone, and we use it to determine how many eggs are still left in this woman and therefore her fertility potential. Another test is called follicular count. This is an ultrasound scan test. We simply do a scan and we count how many eggs are visible in each ovary, and we know after a certain age the number of eggs reduce in a number, and the ones we are able to see on ultrasound scan represent a pool that is still left that we cannot see. That is what we call the follicular count. Now, combining these two tests, the Antumarian Hormone and follicular count, we are able to predict the chance or the potential of each woman that they are having to conceive. There are other tests that used to be done, but they are less sensitive. For instance, follicle stimulating hormone and estrogen levels in early follicular phase. Then we had clomiphene challenge tests. These are not so accurate and they change from person to person and cycle to cycle. So these days we use mainly follicular count and Antumarian Hormone to predict or to determine the ovarian reserve of each woman. And these are tests that are viable, they are simple to do, they take a short time. In a space of 20 to 30 minutes, someone knows their fertility potential. And we usually advise women who are aged beyond 35 years to quickly go for these tests. Of course, we said the number one predictor of ovarian reserve is maternal age. Even in absence of these two tests, as long as age is more than 35 years, then we know that the numbers and the quality of eggs are down, and therefore their chances of conceiving are also down. Now, apart from age, there are other factors that we know that lead to reduction in the quality and quantity of eggs. And in some women, this even happens earlier on, before 35 years. And what are these? Number one, smoking. We know smoking is very dangerous to men and women, but it is more dangerous to women, even passive smoking. Excess consumption of alcohol is also very dangerous. Then there are some treatments for cancer, chemotherapy and radiotherapy, that we know destroy ovaries and their eggs. So if we are dealing with someone who has ever undergone treatment for cancer, we have to measure their ovarian reserve. If someone had surgery on their ovaries, maybe they had a mass or a cyst in their ovaries and it was cut out, then part of this ovary could have been removed, and this reduces their ovarian reserve. Now there are environmental factors like toxins, chemicals in the environment from plastics. All these can reduce the ovarian reserve in a woman. Now there is a condition called endometriosis, which is a painful condition. Such women usually have painful menstruation that also reduces their ovarian reserve. And lastly, if a woman has a family history of early menopause, that is where women undergo menopause before the age of 40, then she's also at risk of premature ovarian failure or early reduction of her ovarian reserve. Now, whenever we are dealing with women with all these risk factors, we tend to measure their ovarian reserve very fast. Now, we know when people are attempting to conceive, we give them a chance of time. For those who are less than 35 years, we give them a chance of about 1 year of regular and protected sexual intercourse for them to achieve a pregnancy. And if this fails after 1 year, we quickly assess them. Now, for those who are older than 35 years, we don't even wait for a whole year. These ones, we give them only 6 months of trying, and after 6 months, if they are not conceiving, then we have to do a number of tests on them. Now, for those who are 40 years and they are trying to conceive, we don't even give them time to go and try. We have to immediately assess them because we know the effect of age on their fertility potential. Now, having looked at the effect of age on fertility, we also have the effect of age on pregnancy itself. Sometimes people of advanced age succeed and conceive, but we know these people are also at risk of other many these complications they are likely to meet during pregnancy. We said these people, first of all, have prolonged time to conception. They delay to conceive. Now, after conceiving, they are at risk of miscarriages. Okay, now they also have a risk of having small weight babies, premature deliveries, and they have preterm babies. They are also at risk of maternal complications like hypertension, diabetes, then antepartum hemorrhage, that is bleeding during pregnancy, and also during labor. These old women have complications of abnormal labor. They tend to have prolonged obstructed labor, and they tend to deliver by cesarean section simply because of the age factor. And even after delivery, they are at risk of postpartum hemorrhage, that is bleeding after birth. And all these are complications that put elderly mothers to risk, and therefore elderly mothers are treated as high-risk mothers, and we treat them with that close attention. Now, having looked at the effect of age on fertility and pregnancy, what options do we have for women who are advanced age and are trying to conceive? Number one, we have to measure their ovarian reserve. If their ovarian reserve is reduced but still with some potential to conceive, we can do ovulation induction for them, or we can do IVF. In fact, IVF helps shorten their time required to conceive. Okay, so we do IVF, that is in vitro fertilization, where we stimulate them and fertilize their eggs in the lab, and then we do embryo transfer for them. Now, for those who we find without eggs completely, where eggs are completely finished and therefore they are in menopause, for them the option is an egg donor. We usually give them eggs from donors which are fresh, and we use their partner's sperms. And there are those who actually have to use embryo donors as well. And then lastly, there are those who have no option but to adopt. Okay, but that should be the last option. We want to give them hope that now there are options. People used to have no options in the past after their age was advanced, but now we have an option of egg donor, we have an option of IVF, and we also have an option of embryo donor, and a number of women now in their advanced age are able to conceive. And we know the dynamics of life now have changed. People take long to think about conception, maybe because of education, career, occupation, and therefore we have to think about their options as well. About our male colleagues, men, we said, don't undergo a process of reproductive aging that fast compared to women, but at a particular age we also see a few of the parameters being affected. Okay, we said men are able to produce sperms throughout their lifetime, but at a particular age that is above 40 to 50, we start seeing their quality of sperms reducing. There are a number of parameters in their sperms that we find going down and reducing. Okay, and these parameters include the sperm numbers or the sperm concentration, the motility, the morphology, those are the shapes of the sperms, and all these reduce their capacity to fertilize an egg. And therefore, we find the time to conception with a man who is aged is also prolonged. It takes longer for a woman to conceive with a man of advanced age, and this is okay. Pregnancies conceived from elderly men tend to end in miscarriages or abortions. Then these pregnancies also have complications like intrauterine growth retardation. Okay, we have babies with congenital anomalies, that is body defects, mental retardation, and so forth. And therefore, when we are talking about reproductive aging, men also can be affected beyond a particular age, and that is age over 40 years, 50 years and above. Now, also like in women, we have factors that can affect men's reproductive potential, and therefore they undergo reproductive aging prematurely. And these include smoking, excessive exposure to heat, because we know heat destroys sperms, and then lifestyle measures, lifestyle issues also. Men who are involved in chemical industries, those in agriculture and veterinary who handle chemicals, we have to also subject them to quick tests. And with a man, it is very simple. We simply do a sperm test. And what do we do with the sperms? We look at the numbers, that is the sperm count. We look at the motility, that is how the sperms are able to swim. We look at the shapes, that is morphology and viability. And that gives you the reproductive potential of this man. This brings us to the end of today's discussion. I hope you've learned something. And in case of any questions, always follow us on YouTube, ATTV, Neo Care Clinic and Fertility Center. Have a good day. Thanks so much.